So I'd like to introduce wonderful nurse Tora Spigner. Yay.
Beautiful women.
Aren't they lovely? Are lovely. Oh, this class has just been making me sing with joy. I believe it.
Oh.
I believe it's true. And Tora is a blessing in the birth community. She's the most wonderful, one of the most wonderful RNs. She works over at Alta Bates. And also in her spare time, she's an Intactivist. And I'm going to let her explain to you what that is and say whatever you'd like to say.
Okay. Hi. So I'm actually an RN with a master's in education, nursing education. And along with working in labor and delivery at Alta Bates, I also teach maternity nursing at Los Medanos College in Pittsburgh. And I just finished my first semester there. It was so fun. It was so much fun. It was great. So anybody looking at going to nursing school, that's a good program. Yeah, Los Medanos. It's a associate's degree RN program. So you can do it in 2 years. Yeah. Because when I started my path towards midwifery, it was with the fact that I need to become an RN first. So it was my second career. And in the process, I had 2 children of my own. They're awesome people. I must say, my daughter is 23, my son is 18. And I grew up in Michigan, which is a state that has a really high circumcision rate. And my little brother was born when I was 10, and my mother made sure that he stayed intact, was not cut, which was just pretty unheard of. About 85% of men were being cut at that point. So I grew up with an intact sibling, and that was my norm. You know, I changed his diapers, I took care of him. It was easy. So that's why I didn't have any kids till I was in my 30s. Because I had that experience of nurturing a child. But when I moved to California in 1990, after I got married, I became really involved in the Intactivist community. And for those of you who don't know, an Intactivist is someone who strives to leave children intact, so that we believe that genital integrity is a right that all people have, that boys, girls, and intersex children should have their genitals left alone because they're owned by them. No one should be cutting them, altering them, changing them in any way. So I tend not to do a lot of, there are some of the groups who do a lot of street activism. I tend to go to birth fairs, talk to parents. I've talked to medical residents. I've talked to other nurses. I've talked to basically peers about why children have the right to not have their genitals altered by adults. So one of the things I did was I brought a circumcision tray, because a lot of people, you know, they grow up thinking that everybody in my family, all the men in my family are circumcised. What's wrong with it? There's a YouTube video called Elephant in the Hospital. I always recommend that for parents. And as a doula myself, I don't take clients who plan to circumcise. And one of the things I do as a doula is I educate my clients about why they should leave their children intact. And my job as an RN and as a doula is to advocate for both the mom and the baby. So if no one's advocating for the baby, you know, what's the point of letting the mom have medication-free pain-free, no cutting birth if we're not doing the same for the baby. So I'm gonna show you guys what a circumcision tray looks like. Has anybody ever seen a circumcision? Or a bris in the Jewish community? It's called a bris when the baby is 8 days old. They cut the foreskin. But I can say that in California, especially in Berkeley, Oakland area, more and more parents are keeping their Jewish sons intact, which is awesome. I'm Facebook friends with a woman who wrote a book called Welcoming Brit Shalom. Yeah. And parents, when they see the harm that's done by cutting babies, when they see the pain that babies go through, people always want the best for the babies. But growing up, we're told that circumcision is best for the baby, but when we're given the evidence that it is not, because 85% of men in the world are not circumcised. But doctors who cut babies because they make a lot of money from it do not tell parents that. They don't tell them the purpose of the foreskin, because I'm sure a lot of them don't even know, because they're not taught in medical school. We're not taught that in nursing school. The only thing doctors know how to do is cut off foreskins. So that's one of the things we have to get into is educating physicians. And I work with some physicians who are definitely pro-intact, who do not cut babies, who counsel their patients about not cutting babies. And if we have more of them on our side than not, that's half our battle. And in California, it was the first state that Medi-Cal did not cover circumcision because it's not medically necessary. It's considered a cosmetic surgery. Okay. Any questions?
What are some of the, benefits of circumcising? And then what are the risks of not circumcising?
Well, the only real benefit to circumcising a newborn is that the doctor doesn't have to fight the child and they make money. There are no benefits, especially medical, because anything that they say that can be a benefit to cutting a baby can be done with less invasive methods. One of the myths about circumcision for babies is that intact boys have a higher UTI rate, but it's like 1.8% versus 1%. Granted,
So it's not really significant.
no, it's not significant at all. There are some very flawed methodology. Thank you. Sorry, I'm so I can't talk. Studies that have shown that circumcision can reduce STI or HIV transmission, but that is in adults. So why are we circumcising babies to have a drop in STI or HIV rates when condom use is 98% effective? And why can't we teach our boys, like boys in Europe and Asia and South America, to use condoms? And they're much better at using condoms. Because one of the things that happens when a boy is circumcised as an infant, the body tries to protect itself, because that is the foreskin's purpose, is to protect the penis, to protect the glands of the penis, the head of the penis. So what the body does is because that foreskin has been removed, the body tries to shield that glands or the head of the penis by developing scar tissue and keratinization. So it's like when you have a cut on your arm, your body tries to put scar tissue over it to protect it, right? So that's what the body tries to do for a baby. So of course that decreases sensitivity. So it's been found that circumcised men are much less likely to wear condoms because that cuts down on their sensitivity even more. And I don't know how you people are really young, but men in my age group, I'm 56. You know, the majority of men born in America were circumcised. So getting men my age to wear condoms is always an uphill battle. Not always, because there are some men who are considerate and, you know, they think ahead. But I've seen so much flack from men who don't want to use condoms because a lot of men, because of the circumcision they had as children, actually develop erectile difficulties because they become so desensitized. Because the foreskin is actually the most sexually sensitive part of the whole penis. It has 20,000 to 30,000 nerves in it, while the clitoris has 8,000 to 10,000. So when you remove the most sexually sensitive part of the body, of course there's going to be some feedback that they're not going to get anymore, right?
Right.
So there really are no medical benefits to circumcising a newborn. So, and the other thing is, if you want to look at how circumcision is done in a newborn, the foreskin in a newborn is attached to the glands of the penis, like your fingernail to your finger. It's called a preputial. It's a membrane that holds the foreskin, so nothing can get into it. It's like a sphincter, so it keeps contaminants out of the penis. So when a boy is circumcised, they have to break that membrane. So it's like taking a instrument and taking it under your fingernail to break that membrane so that they can remove the foreskin. And I've had parents tell me, well, the baby didn't even cry, or there was no bleeding, or there was no cutting. I'm like, is it possible to do a circumcision without cutting? Because how else are you going to get the foreskin off if you don't cut it off? There is a procedure called the Plastibell, which involves removing the membrane and then putting a plastic cone over the glands of the penis, and then tying a string around it. So basically, you're letting the foreskin rot off.
Yeah, starving it of the
Right,
circulation.
right, exactly. So basically, you're causing gangrene of the penis, and sometimes that doesn't stop at the foreskin. But babies have had more botched procedures with the Plastibell than any other. Because sometimes they say, oh, I'm just going to keep going and take the whole penis.
Yep.
So babies have lost their penises, have lost their lives because of infection with the Plastibell. And then a lot of men, if you know a man who's circumcised, he always has a scar. And sometimes you can tell what kind of procedure was done to him by looking at how the scar is. So there's a procedure with an instrument called the Gomco, and a lot of times that'll leave an uneven scar, especially on one side or the other. Because of course, when you're circumcising a baby, you don't know how big his penis is going to be when he grows up. You don't know how much tissue you're going to take. There's no line that says cut here. So, I've had physicians tell me, well, I want to do the circumcision because I do them well. Okay. What does that mean, right? Do you see this baby in 20 years? And you get to see the results of your handiwork and see how that turned out for that child. So I think I actually have a tray.
As an adult, does Medi-Cal cover circumcision?
Only if it's medically necessary. It's like,
I come from I work in HIV research, and I've worked for USAID and CDC, and then a lot of our tax dollars go into what they call safe male circumcision globally as an HIV preventative. The difference being that these adult males consent to it.
right. But the problem with that is that they're not given full informed consent. They're not told, the HIV studies, one of the problems that they went to Africa and they told these men that if they're circumcised, they'll have less HIV. The problem is, those men were also counseled about condom use. And of course, after they were circumcised, they could not have intercourse for a certain amount of time while they were healing.
Yeah.
So of course, statistically, those men look better on paper because they're not exposed to as much HIV. And one of the problems they found was in the study that some of the instruments they used were not cleaned properly, and men were not tested for HIV before they had their circumcision. So how many of them were given given HIV through the circumcision procedure? And then there was no follow-up to see, 6 months down the road, a year down the road with these same men to see if they ever converted HIV or were tested again. So that was the big fault with that study. And I'm like, why are American
There's multiple
American
studies.
researchers?
There's not just one. There's
There's-
multiple studies.
There's
But also,
three.
yeah,
There's three well-known studies.
Males circumcised in adulthood can still get HIV later.
Right.
That's true.
That's very true, because that experiment didn't work in America. When I was an undergrad, HIV didn't even have a name. And I was a medical technology student, so that was our job, is to look at lab work. And we had this disease that was affecting gay men, and nobody knew what it was. So you realize that at that time, at least 85–90% of men in that 20 to 30 year age group were circumcised in America. And and we still have the highest HIV rates. So that experiment didn't work in America.
Yeah.
So why would it work somewhere else? Right.
They're still pushing
because,
it though.
They're pushing it because they're making money. Most of the founders of the study make the instruments that are used to cut them in. And they're getting funding from Bill Gates and the Clinton Foundation, PEPFAR. Millions and millions of dollars are given to these people to circumcise black men in Africa. So it's very racially motivated. And I have a real problem with this information that they're not giving people. It's like, it would save them so much money if they just gave them condoms and education. That's what worked in places like Bangkok, Thailand, where most of the men are intact. But because of the prostitution and the sex work, a lot of HIV was being passed. But what they did was they had an education campaign. Because, we know there's so much shame around sex that is enforced by the world, religion, etc. So they had a campaign where they talked to men about using condoms. They supplied condoms, they gave them education, and the HIV rate dropped in 5 years, to less than half of what it was before. So that can be done anywhere.
Good. Revolutionary idea.
Yeah. So this is a, bless you. This is a tray. I don't know how much fits on here. This is a gampo. This is the instrument that's used, and what it does,
Looks medieval.
I know,
It
right?
does, yeah, it does.
Yeah.
It's like
And it's
speculum,
heavy.
and then speculums look really
They do. And this is what, after the boy's foreskin is removed, then there's a little bell. This is what goes over the glands of the penis, and then this is used, and then it's cut around.
Like when you take
Kind of
the
like a
wrapper
can
off a
opener?
wine bottle, it
Like you're
goes.
Like the can opener, right,
Or would you say like a can opener?
Yeah, 'cause it looks like you're turning it. Are you turning it?
right.
Wow.
Yeah, this turns to tighten, because you want to put pressure on it to stop it from bleeding. but then, babies still bleed. So a job as a nurse. And of course, I refuse as a conscientious objector to be involved with circumcision in the hospital.
Yeah.
And the one good thing is because I work the night shift, so we don't do circumcision at night. And I work in labor and delivery, and they do them in postpartum. But I can say that less than 10% of babies are being cut at my hospital.
Less than 10%, wow.
Yes. In California, it's actually 22% for the whole state are cut now. And, partially it's because Medi-Cal doesn't pay for it. So some parents will wait until the baby is 3 or 4 or 5 days old and go to the pediatrician's office and pay cash. And it's easy money for the doctor, I think, $300, $400, $500 for 10 minutes of work and changing that boy's life forever. And one of my big things is I had like an epiphany one day. It's like, why would you send a mother home with a newborn? We know how hard it is to recover from childbirth, to breastfeed, to try to have a good relationship with that baby, and then give them wound care on top of it, because you're basically creating a wound in a diaper. So then you wonder why the infection rates, and we don't track those. We don't track how many babies have bleeding issues after circumcision. We don't track how many babies have infections after circumcision. We do not even track how many babies die after circumcision. And that's, I think, definitely one of our infant mortality issues in this country, is that because we circumcise. We're the only nation in the world that circumcises babies for non-religious reasons. And that's something that people have a really hard time wrapping their head around. It's like, even in Israel, there's a big Intactivist movement and there are more and more parents who are questioning the religious aspect of cutting their babies. So it's, like I said, so 85% of men in the world are intact. And it's dropped overall in the United States, about 50%. But on the West Coast, of course, we're leading. Oregon, California, Washington State, in the 20s, 20% or less. And it all comes about because of education. And our job as doulas is to educate our clients about birth, about self-care, about infant care, breastfeeding. And of course, I was the breastfeeding queen with my children. I breastfed my daughter till she was 2, till her 2nd birthday. I breastfed my son till he was 4, his 4th birthday. He said, I still remember what kneading milk tastes like.
Aww.
He's 18 now, so he would not want to tell this story. And of course he is
Bring that
intact.
up at the wedding.
What's that?
I said bring that up at his wedding.
Fascinating. No. The story would be that when he was 3, he was supposed to be weaned. So on his 3rd birthday, he told me that he was not turning 3, he was still 2.
Oh, no.
He said people would say happy birthday to him, he would walk away. So I have a picture of him sitting on the counter next to the birthday cake with his head. So we had to negotiate. I said, okay, so you can only have Minnie at home. Okay. You can only have Minnie at bedtime or nap time. Okay.
Okay.
Yeah.
That's a good deal.
Right,
Right.
yeah.
Right.
Smart customer. How long after a baby is born are they typically circumcised? Is it like within
depends on-
hours?
Well, it depends on where your baby is born and who does the circumcision.
Okay.
Now, when I worked in San Francisco at CPMC, the obstetricians do it. So they want to do it within 24 to 48 hours while you're still held captive. While you're still a patient. Because that's more convenient for them. Because there is one physician who's notorious for lining her babies up at 6 a.m. and doing all her circs, just going down the road, cutting her babies, and then going to her office hours. at Alta Bates, the pediatricians do it. So if they're not done in the hospital, which is pretty rare these days, it's done anywhere from 3 days to 2 weeks.
Okay.
Right.
And they have to come back to the.
They have to go to the
hospital,
office
to
and do it.
the pediatrician office.
They go to the office and do it, yeah. So, now like Kaiser, their head of pediatrics was a Jewish physician who advocated for circumcision.
Mhm.
So Kaiser does them pretty routinely, and they push them. I have had a couple of doula clients deliver at Kaiser, and they were asked numerous times if they were gonna circumcise their son, which one is illegal. You cannot solicit for an unnecessary procedure. So legally, if anyone even asks you if you want a circumcision, that is soliciting. So, because it's not a procedure that is necessary for the child's life or well-being, right? And so I've actually had parents tell their providers that if anyone asks me, if they ask once, that's a warning. If anyone asks me again, I'm gonna call my attorney. That's what I tell my clients if someone asks. But of course they're educated, so they know. Right, yes.
Can I have a time check, please?
Yes.
It is 5:13.
Okay. These are good questions.
Hmm.
Any other questions? So like I said, there's a YouTube video called Elephant in the Hospital. It's done by a professor at Georgetown, and it's very unbiased. Basically, it just makes people try to look at the ethics of circumcision and why children should have the right to keep their genitals intact. It's called Elephant in the Hospital. So you can watch it on YouTube.
And it's also good, it's very good to have clients watch it
Yes.
and to watch it with them. It shows the operation. And one of the things that every caretaker has to have their own boundaries about that. Tora's boundary is that if you're circumcising, I'm not your doula. My boundary is you need to be willing to take in information. And I've had many folks who were totally for circumcision and changed their minds right up to the very last minute. So, we get to decide what our line is in the sand around that, and to, ultimately, Tora respects the client's wishes. She's just not going to be their doula. It's your child. You get to do what you feel is best, but you've been told why she's not going to do it, and whatever. But and with us, or with me, excuse me, it's about people are so brainwashed about this, and also for me, I have what I feel like the understanding of the father as a sexual abuse survivor. Very often, the little boy is circumcised because his father is circumcised.
Yeah, that's
Yes.
what I was gonna say.
Yes.
And so I try really hard to get up with them to make that, to establish that connection and friendship that then allows me to talk to the family and talk to the father and give him the internal support so he can let his child have a different reality. Because then he has to accept that he's been wounded, and that's
That's hard,
Yeah.
especially for a lot of men, and I see that. Because of course in the hospital I can't pick who I take care of. But I can definitely say that when parents, because I never ask them if they're circumcising, of course. I always give them intact care. I tell them how to care for their son. With an intact boy, it's easy. You just clean what's seen. No one ever retracts the foreskin on a baby except the boy himself. He's the only one who should ever manipulate the foreskin in any way. Physicians, parents, it's not necessary. So that actually makes infant care for little boys easier the little girls, because we got little girls, they got all these crevices and wrinkles and things to clean, especially if they have a big blowout diaper. So that is part of the education, is we educate what's the norm. Leaving your son intact is the norm. Worldwide, parents don't even question this. In Europe, they think it's really barbaric that Americans cut their babies, because that's just not their reality. Every pope for the last 2,000 years has been attacked, because there's actually a Catholic doctrine that forbids circumcision. But people don't know about that. Because I also had parents tell me, well, it's in the Bible. I said, well, so is slavery and stoning of women, but we don't do that anymore.
Also, what is considered circumcision in biblical times is not what they do to little boys now. It's a nick or a scar. It's a tribal scar, not the removal of the entire foreskin.
Right, exactly. Yeah. What else was? So you'll see my car is the one with the no cert license plate.
Really serious.
Well, it's so much. You can just do so much education just by having bumper sticker on your car.
It is.
Right? My daughter has the intact genitals are a human right bumper sticker on her car. My son, he's getting my old car, my Camry, because I just bought a new car. And I'm getting my plates put on it. And he's like, oh my God, thank you. It's like, Mom, you're always talking about penises. Yes, baby, that's what I do.
You're welcome.
Right. You were at protests when you were little, but you didn't know.
On the global scale, I find it amazing how many Americans, particularly American feminists, like to, complain about female genital mutilation
Right.
in other countries,
Right.
and they don't even make the connection
Right.
that it's
Exactly.
the same thing here
Yes.
in terms of just like basic procedural,
Right.
like what
Exactly.
is being cut off, most sensitive part of the genitals, and
Right.
I think that's something that is always something, and you have to tread, and I'm sure you speak diplomatically,
Right.
peacefully with your clients, but pointing out to them their own cultural blindness in that
Yes,
sense can be
that's very
helpful
true.
too.
That's very true. And I'm from Michigan, so there's a case going on right now where there's a doctor in the Detroit area who had girls coming from all over the country to have FGM. And so we have to speak to, well, if it's a cultural thing and what she basically did was she nicked the labia and the clitoral hood. I mean, I'm sure it was traumatic for girls, but you can't tell me that removing the foreskin of an infant is not traumatic. They just don't have the words to tell you. Because our body remembers that trauma. And I'll never forget, I was at a funeral, and a guy walked some things out to my car because I was taking him to work. It was one of the nurses, her husband passed away. And he looked at my license plate, and he's like, circumcision, isn't that normal? He said, no, because we realize that, 80% of men in the world are not circumcised. And he had this epiphany. And the first thing he did was he called his parents. He must have been 30-year-old young man. He called his parents in tears. Why did you do that to me? Because he'd never thought about it before. And that's the problem, we don't talk about these things in our culture. We don't talk about what's done to women in birth. We don't talk about what's done to babies after they're born. We don't, we try to do better by doing skin to skin, but think of many of us were taken from our mothers when we were born and put in the nursery and, breastfeeding. Oh my God, why would you do that? That kind of attitude. But hopefully we're slowly making bounds and educating parents about why it's important to have skin to skin, delayed cord clamping, breastfeeding, not cutting your sons, not cutting your daughters. Because as a nurse, I've seen circumcised women, and I've seen they run the gamut from no labia or no clitoral hood, because that's the most common form of female genital mutilation, is they just remove the clitoral hood, like the prepuce in men. But sometimes they actually remove the labia, and in the most severe form, which is also the most rare form, is when they sew them up, or they remove the clitoris, or both. And that's the one people always talk about. But that's the most rare one. That's like saying that we're cutting the whole penis off for boys, and that does happen, right? So I've seen the after effects, and it really is interesting to me how much fear women have around their genitals when it comes to dealing with women who've been have had female circumcision. So if it's sometimes it's almost palpable, because they want no pain. They want an epidural when they're like 1 centimeter. And especially they're young women from Ethiopia, Eritrea, Egypt, Yemen, Somalia. So we can only imagine how much of that is present in our young men who have been cut as babies, but they don't, they totally internalize that, and they don't talk about it, or they don't process it, or they don't even think about it, because making them think about it is half the problem. And it's really interesting talking to some young fathers about, but why would you not give your son the option to keep his foreskin intact? I actually had a dad tell me, well, if it was good enough for me, it's good enough for him.
That's the same thing moms say when they're having their daughters circumcised. Oh, well, I had to go through it too. Yes, it was horrible and traumatic, but if I just got through it,
Right.
Yeah.
Exactly. Yeah, you see that.
And that's a trauma reaction, because if you didn't have that stony shell, you'd be hysterically crying inside. Like your inner infant is probably still screaming in your ears from what happened to you. And so you have to allow it to happen to you. Similarly, mothers who've been abused or molested, when their daughters or sons are abused and molested, the mother will smack the daughter, which is trying to tell that something happened to her. Because she's smacking it because she can't hear the replay of what happened to her out of her kid's mouth. So, yeah, it's horrible.
Right, and I've had so many mothers who don't want to cut their sons, but the father is insisting. So they, acquiesce to the dad saying, well, he's got the penis. I say, yeah, but you have the foreskin. So he's not the expert on anything that this baby has, except just the bare bones penis. So that sometimes is a wake up call for parents. So there's an awesome book. There are some really good books out there about circumcision. In fact, most of the ones that are written by Jewish men. The men who are most cut, and there's some great videos out there cut by Sengar, who was raised by a Jewish surgeon, and he didn't want to cut his sons and his father. In fact, I worked with a Jewish physician, and she did not cut her son, and her parents actually basically disowned her because she did not. Because she did not cut her baby. Yeah, it's like, really? I mean, as the baby got older and they had a relationship with the child, but I'm like, why would you do that kind of traumatic cutting of a relationship because of a belief?
It's a book or a movie? Cut?
Cut, it's a video,
How does
it's
it
a movie, it's a movie. And we have there's a new movie coming out called American Circumcision. It talks about circumcision. And this is a book that my friend Billy wrote. And it talks about circumcision exposed. I used to have a whole box of these, I would give them away. They probably are somewhere in my house, but we're in the process of remodeling. If I find them, I'll definitely give them to you.
Right, I will give them.
But yeah, but there's a video that I'm in, called Nurses for the Rights of the Child that I did, oh my goodness, 10 years ago, maybe. Yeah, it's on YouTube, and you can just put in my name. It's Tora. Last name is Spigner, and that video will come out. And I talk about infant circumcision in that video.
Can you spell your last name again?
Spigner. First name Tora. Which I get a lot of patients who ask me if I'm Jewish because my name is Tora. So no, it's actually Japanese. It means tiger.
You need the H at the end for it to be Tora.
Well, you can have it without the H. So yeah, any more questions? You guys ask awesome questions.
Let's do one more time check, please.
It's 5:28.
5:28, we do need.
Yes, awesome.
Anything that you wanted to add?
Yeah, there's some information here.
Thank
This-
you so much.
Yeah,
You're very welcome. The Infant and Young Child's Bill of Rights, because children do have rights. The United States has chosen not to join the International Children's
Court.
Bill of Rights.
We
I
don't
know, isn't
know
that
that.
not shocking, right?
Yeah.
When I talk to high school students, I always bring them this, because, young people are much more open to information. Shocking, right?
Yeah.
There is hope.
There is hope, there is hope. Thank you.